parents sue California for law that forces children to get vaccinated. Opinions on vaccines vary widely. Some say they are the greatest public health development ever invented, while others believe they are a dangerous, even deadly experiment. Whatever you believe, the law aims to have every child vaccinated. There is no law on the federal level mandating vaccination, but in all 50 states, vaccinations are required for children to enter the school system. Most states, except for Mississippi and West Virginia, allow exemptions based on religious beliefs, and 19 states allow exemptions for philosophical objections. But these allowances won't last for long in California. Last year, California lawmakers passed SB 277, a law that allows vaccine exemptions only for verifiable medical reasons. The new law poses a big problem for California resident and mother of two Sharon Brown. Despite repeated assurances from the Centers for Disease Control (CDC), the World Health Organization (WHO), and several peer-reviewed studies that conclude there is no link between vaccines and autism, Brown refuses to vaccinate her kids. The state has to prove that vaccination is more important than education. Brown said she wasn't always wary of vaccines, but her mind began to change when her firstborn began to develop adverse symptoms after her first round of shots. As the shots continued, the symptoms grew worse. I started researching vaccine problems, and once I looked at the efficacy, safety testing, and ingredients in vaccines, we stopped immediately, Brown said. My daughter was 9 months old at the time. I'm confident she would be autistic if we had continued with the vaccinations. She just couldn't take it. Our second child is 100% vaccine-free, and he's insanely healthy. He rarely gets sick, and he's never been on a medication in his life. He's 7 years old now. Related coverage: China uncensored, $90 million scandal, expired vaccines sold across China once the new law goes into effect on July 1, 2016. Brown's family will be forced to either vaccinate, homeschool, or move out of state. She's not interested in any of these options, so she's decided to challenge the law in court. It's amazing. You see people fleeing war-torn countries to go someplace safer, and we're going to have to flee California in search of an education, she said. Since we don't want to move, we've decided to sue. Constitutional rights demonstrators carry placards during the Green Our Vaccines march in Washington on June 4, 2008, raising awareness of toxins in children's vaccines. Mendelnon, AFP, Getty Images. Brown is one of 8 plaintiffs in a lawsuit aimed at overturning the California law. They've hired controversial trial lawyer T. Matthew Phillips to lead the case. Phillips proudly calls himself the most dangerous lawyer in America because he goes after entities other attorneys won't touch. Last year, he was head of a class action lawsuit against chemical giant Monsanto for false advertising on herbicide labels. However, the case was dismissed when a federal court determined that the California law that forbids false advertising is fundamentally at odds with federal laws governing agricultural chemicals. Related coverage: and vaccine mom changes her mind after all of her children get sick. For the vaccine case, Phillips's strategy is to challenge the constitutionality of the California law. Under the state constitution, all children have a right to an education. Phillips says the new law infringes on this right. and the First Amendment of the U.S. Constitution. In most lawsuits, the plaintiff has the burden of proof, but this case is different, he said, because it involves the First Amendment, the rights of the parents not just to hold personal beliefs, but to freely exercise those in a meaningful fashion. They have a right to assert those objections. So the burden of proof is on the government. This is significant. The state has to prove that vaccination is more important than education. As a guy who has been in court for 25 years doing constitutional law, I can't think how the Attorney General is going to prove this. Herd immunity. But what about the rights of the other parents whose vaccinated kids have to attend school with unvaccinated classmates and the potential risk of disease they pose? The rationale for getting everyone vaccinated regardless of personal belief is called herd immunity, or community immunity. The idea is that if enough people are immunized against an infectious disease, it will protect vulnerable individuals, such as infants, pregnant women, or the immunocompromised. The impetus for a stricter policy to impose herd immunity in California came in 2015 when a measles outbreak that started in Disneyland led to the eventual infection of 113 people. Since the state was at that time experiencing historically low levels of vaccination, lawmakers insisted that something needed to change. In a press conference last year for SB 277, California Assemblymember Mark Levine defended the law on the grounds that vaccination contributes to the greater good. We live in a society where we have a social responsibility to act in a manner to protect not only ourselves, but others as well, Levine said, comparing mandatory vaccination to measures such as driving safely or paying taxes. But Phillips say this greater good argument in support of vaccines doesn't hold up when you consider the big picture. They call this a public health crisis, but I don't know anybody with measles. Do you? He said. But we do know that a number of American children have died from vaccines. Related coverage reason for lower vaccination among immigrants. It's not distrust vaccine fatalities. There is no clear way to tell how many lives vaccines have actually claimed, and estimates vary widely. At the high end is Phillips, who figures that an average of one child per month is killed by vaccines in the United States. He also alleges that 10 times as many vaccine deaths are written off as sudden infant death syndrome. Reports from a U.S. government public database called the Vaccine Adverse Event Reporting System, VAERS, which can be searched through the National Vaccine Information Center, suggests that measles vaccines are actually deadly.